Absolutely. Well, you heard John Boehner a moment ago. He also called the health care bill a monstrosity. Is it? Is repeal the only answer? Joining us tonight, Democratic Congressman Brad Sherman, a major supporter of the health care bill, and Republican Congressman Ed Royce, an opponent of the bill and now a member of the majority in the House. Congressman Royce, let me ask you first. Health care bill, what steps does your party take to repeal this?
Well, I think what we will do, you'll see this is a lot like the Medicare Catastrophic Coverage Act of 1988, which Rostenkowski initially passed, and within months people found out what was really in it. Within a year they had to repeal it. I think as people discover just how unsustainable this is, as they see the cuts to Medicare as a result of this legislation, as small business struggles under all the mandates and taxes under the bill, you're going to have a groundswell of opposition and a demand that it be repealed and replaced with those common sense solutions that I think we know should move through the House.
Congressman Sherman?
I think that's what's going to...
Let me ask Congressman Sherman to react to that.
I think this is a necessary health care bill. The people overwhelmingly voted for President Obama, knowing that this was his signature piece of legislation. And if we go back to the old system, that was spiraling downward. You had a system where there were more and more people uninsured. They'd go to the hospital emergency room. The hospital would never collect. That meant the hospital had to raise its rates on everyone else, leading to higher insurance costs and more uninsured people.
But voters also spoke up at this election saying to Republicans, we like what you're saying, and they were saying they wanted to repeal health care, Congressman Sherman.
I think only about half the voters say that they want to repeal, and they want to repeal and replace, which means they just want the bill to be better. And of course, we're looking at ways to make it better. But to go back to the old system where you had more and more people uninsured and showing up at emergency rooms, and you had insurance companies more and more aggressive, dropping people as soon as they got sick. So you thought you had insurance, you thought your employer provided you with insurance, and you had insurance right up into your 6th day in the hospital, and then you didn't.
Okay, Congressman Royce, the president and Harry Reid are saying they're open to tweaking the health care bill. What does your party say to that?
Well, this is going to take a lot more than tweaks to fix, and here's why. Massachusetts is the one state in the nation where you have a mandate where everybody has to purchase health insurance like in this bill. The consequence is that those are the highest rates in the country, and it's unsustainable for the budget of the state. So we've just added an entitlement with a cost of $2.4 trillion that we can't afford. We've partly done it by cuts to Medicare, by making Medicare insolvent. This is not sustainable. We have to address it. We have to reverse this legislation and do something about medical malpractice liability, and do something about the balkanized situation where we've got 50 different states with insurance where you can't sell across state lines. Create one national market for insurance. That's a Republican alternative that will bring down the cost to insurance. So that's what we should be doing.
You have some ideas, Congressman Sherman. Can the Democrats stop a repeal?
As a practical matter, we can stop a repeal and will if the Republicans use regular legislation. It took us a president and 60 votes in the Senate in order to pass a bill. It would take the same thing to repeal it. It is possible for Republicans to hold a part of the government hostage, to say we won't fund the FBI unless the Democrats agree to repeal health care. And so you could see a section of the U.S. government shut down. We've got a debt limit bill that will come up in the spring, where if we don't increase the debt limit, the federal government could default on its debt. And it'll be interesting to see whether Republicans pass this, quote, must-pass legislation, or whether we have a government shutting down or default crisis.
All right, gentlemen, quickly, if I can ask you one last thought. What can you expect as you head into next year? Congressman Royce, start us out.
Well, I think you can expect us to tackle this issue on health care reform. You can also expect us to do something to make sure that these tax hikes don't go into effect. Because one thing we're worried about is the 118,000 new jobs that the federal government have produced at a cost of 3 million jobs in the private sector. We want to reverse that and have the job creation, the real jobs created in the private sector. Increasing taxes on the American system is not going to produce that economic result. We'll be addressing that as well.
All right, on the Republican side, thank you so much. Congressman Sherman, sum it up for us, please, what you're expecting as we start off the new year.
Well, I think we'll continue, as we have month after month, to see increase in private sector employment. Of course, when Obama took office, we were seeing dramatic free falls in total employment. I think there will be a lot of contentiousness in Washington, and I would hope that we would extend the Obama tax cuts, the $800 a couple, $400 for every single taxpayer. That's the most important tax cut to extend for at least 1 year.
All right, the Democratic viewpoint. Gentlemen, thank you so much. I can tell you our viewers here that Fox 11 will be watching and continuing to cover this. Thank you.